I think it's actually higher in Franklin County because there's such a vast area. I want to think it might have been like 60 to 65% of people that are eligible are not getting it. It's free. It doesn't cost you anything. We don't charge anything for our services. So we don't charge for all the equipment we put in the homes. We don't charge for any of the medications we provide. We don't charge for the people that are going out to see them on a regular basis. It's all covered by Medicare funding and private insurance funding, and then what other costs we provide that isn't paid for by Medicare, we eat that cost. We assume that cost. And so there's not very much in healthcare that's free. There's also not very much in healthcare that's really there for the person getting the service. And we do a really good job at trying to meet the patient's needs where they're at. And where they're at today might be a full code, but where they're at 3 months from now might be a DNR. It might be, you know, that's my goal, is to get the word out, you know, what hospice is, and dispel the myth that every hospice is the same. Because we're not like Ohio Health. We're not going to be like Mount Carmel East and all the other. I mean, there's some hospices here in Franklin County that just have like 5 patients because they're just startups. A lot of the facilities nowadays have their own hospices. So you're going to find that when you go into some of these buildings, that they're using their hospice, that their company's hospice, because most of these facilities are being bought by bigger companies. One of the hospices here locally was owned by Roto-Rooter plumbing company. And so it kind of just goes to show, you know, you don't have to know a lot about healthcare and hospice to be able to own a hospice. So we take pride in the fact that we, you know, we have a good group of people backing us that help support us and kind of help keep us going.
With your med list, if you're treating somebody, say who has cancer, you're treating them for pain control, would you also list on your list, they have a heart history also, do you have all those lists of meds?
Yes.
Just what you're treating for?
Yes, we have a whole list of their meds, so we always know everything that they're on. And then we have a clinical pharmacist that we work with to make sure that there's no interactions, or that if they have cancer, but making sure that we're not damaging their liver, or, you know, so we're also looking at all that. We also have a list on their med list that has all their allergies. But yeah, we do. So we manage the whole thing. So even though we're not necessarily paying for their heart meds, we know what heart meds they're on. We also usually know what heart doctor they're seeing, if they're still seeing a doctor.
So if you have a folder with all the information, it's everything about it.
Yes, yes. But we don't usually, unless a family asks, have all those in the home. So you may not see a med list in the home because we find they're changing all the time. We usually have a list of like PRN medications in the home so that they can mark when they've given it. We count all of our narcotics. We're running into a lot more drug diversion problems, and so we count all of our narcotics, and they'll have a list in the home of what narcotics they're on, and if they're taking like Ativan or bowel regimen, anything that's PRN, we usually have a list of all those in the home. But we don't always have a list of all their scheduled meds in the home.
No matter which hospice organization, though, you all fall under the 6-month thing, correct?
Yes,
that's a state,
absolutely.
That's a state law.
That's a Medicare law.
That's a Medicare law, okay.
Yeah, so every hospice is going to have that same life expectancies. It's all about how it's translated then. So some hospices are more liberal, and some are more conservative. So the conservative ones may say, we're only going to take the ones that really look like they're going to pass away in 6 months or less. And then some are more liberal, where they'll take a chance on the patient, and knowing that they may have to discharge eventually if they don't meet qualifications. Stroke is a real big one, because you see this big downward trend when the person has a stroke, and then you start seeing this upward trend if they start to recover from that. And you usually see that in the first couple days. Pneumonia is another big one. COPD patient with pneumonia, and go down real quick, and then they start to come up as their pneumonia clears. Sometimes, not always. But some hospices won't take those risks on those patients. They're going to wait until they're much closer to passing to determine if they meet that criteria.
Okay.
So you may have answered this while I was out of the room, but so patient on hospice care at home, they pass, they call you guys, and you guys always come to the scene, correct?
Absolutely.
And then do you have to call law enforcement or?
No.
You don't
No,
have to?
we do not have to call law
Okay.
enforcement. Yeah, we do not. The only time, I can think of like 1 or 2 cases where we have, because we've suspected maybe there was something besides just natural death.
Somebody quickened the process along?
Yeah, so there's a couple of times I've been involved with having to call, or we've had to call because there's family, the dynamics going on that aren't safe for our staff. So we'll call in those instances, but on a normal passing, we don't call EMS.
Okay. Or police.
Or no police, yeah.
So will that change our protocol? If we have a residence in a hospice that
No.
passes, do we have to call PD? If we get called there by accident?
We don't necessarily have to call PD. That's, the dispatchers will send them if they want, but if they're on hospice, I'm gonna call the hospice nurse.
Well, but if we go up on a code 1 and we
On
find out
hospice,
they're on
we will-
hospice, we can tell them they don't need to
Right.
respond, correct?
Right.
Yeah, any case I've been on where they've called EMS, the police also has been there. But typically they don't stay. Like, I don't know, is your protocol, like if something like that happens, the police officer has to stay? Or you guys-
I think it's a
no?
natural thing for our dispatchers to do, but again,
Oh, okay.
you know,
It
they
just
they show
depends.
up and they go, oh, it's a hospice patient, and they turn around and leave.
Yeah, but that's been the experience we've had. They've shown up and they've been kind enough to, you know, give their respects, to be very pleasant with the families. And they'll stay. They'll be very kind to stay though if we feel like there might be a need for them to stay. How is Worthington's like? Is there much crime? Do you have areas of Worthington that are pretty?
Just like any other suburb.
Yeah. That's where we run the most risk sometimes in inner city Columbus, like right downtown. If we have a patient there, we run into sometimes issues where at 2 o'clock in the morning we wouldn't want to be standing there with the family.
We don't have too many of those.
You don't have too many of those. That's good. This is one of the quotes I got. It's from the person that actually kind of created hospice. She was in England, and she's the one that kind of came with the hospice movement. But I think this just solidifies like what we do. It probably can speak to you as well. It says, "You matter because you are you, and you matter to the end of your life. We will do all we can, we will do all we can, not only to help you die peacefully, but to also help you live until you die." And I just think that epitomizes what hospice is that my goal in most days is not to go in and talk to people about dying every day. My goal is to go in and talk to them about what they did when they were growing up and how they lived their life and talking about what things matter to them. I think we lose sight of that. When I see a 90-year-old patient, I often forget that they were once 20, that they were out going to parties and they were in the military, that they were doing all these wonderful things. So I think it's sometimes nice to look at those things and to be able to remember those things with them. I think people look at hospice as like death dealers. We go in and we just talk about death and it's all down, but most of my job is very positive, and I'm sure you guys have been with people as they've died, and it can be a very beautiful process.
Right.
It can be a very nice thing
Have you
to
been?
see.
You're not funny.
That's not funny.
I'm sure maybe in the cases that you get to see them passing away, maybe some of them aren't the best of cases. I don't know. Do you have any other questions or
How many steps left in this hour?
anything you guys can think of?
No, thank you very much.
I've got some pens and papers, and there's some of our brochures, my card's there with my phone number on it. So if you think of anything or have any other questions, you certainly are, welcome to call me.
2 o'clock in the morning?
If I'm on call, you're certainly welcome to call me. That's fine.
Well, we won't know you're on call until we call you.
Well, that's true, but luckily it doesn't have my cell phone on here, so you'll get my voicemail at 2 o'clock in the morning. Here's a booklet, and I only brought one of them just so you guys could see it, but this is a book we give to all of our caregivers, whether they're home patients, nursing facility patients, but it's called When the Time Comes. I'm not sure if any of you have ever seen it before or not, but essentially what this is a book that we give our families It's in very,